February 2025 is Heart Health Month in the United States.
Heart disease in the United States is the leading cause of death. Every 33 seconds, there's an incidence of cardiovascular disease. Approximately 702 people died from this in 2022, and that we would equate to about 1 in every 5 deaths. The big shocker is that this would cost our healthcare system approximately $252 billion.
If you look at this map, this is the prevalence of heart disease across our country. And if you can see, it leans a lot towards the east of the country. And an interesting thing, if you look at the map of obesity in our country, it almost correlates to that. The two most common heart conditions in our country, according to the CDC, starts with coronary artery disease. In 2022, coronary artery disease killed almost 372,000 people. It is estimated that 1 in 20 adults over the age of 20, that is about 5% of the population, have coronary artery disease.
So according to the CDC, the second most common is heart attack. And in the United States, someone has a heart attack about every 40 seconds. And when you look at the statistic of about 805 people having heart attacks, of which 605 is their first, that would mean it's about 75% of the first heart attacks is had by people. And 1 in 5 heart attacks are silent. So what that means is the person is not even aware that they had it.
The key risk factors, according to the CDC, starts with high blood pressure, high cholesterol, smoking, diabetes, overweight and obesity, unhealthy diet, physical activity, and excessive alcohol use.
Now, this is where Johan and I have a little bit of a disagreement with what the CDC says, because we feel that the order in which those risk factors are arranged should be rearranged. We do believe that the number one problem is definitely got to do with the diabetes crisis we have in this country. And looking at that, the two elephants in the room that barely get mentioned anywhere is inflammation and oxidation. And probably the biggest reason is because there's no real prescription for this. You can't really prescribe something. You have to make the necessary lifestyle changes.
Don't become a statistic in 2025. Be proactive and do these simple tests to know where you are. Go get your blood pressure tested. It is free at most pharmacies. Then get your cardiometabolic panel and see what your HbA1c is. That is a diabetes reading that is included in our cardiometabolic panel. This is our all-in-one test. It tests for your A1C and insulin, which is both very important. It has your cholesterol panel, and also what nobody tests for is the hsCRP, which is an inflammatory marker, which we just now mentioned is one of the big elephants in the room. Lifestyle diseases cannot be treated with prescription drugs that only mask the symptoms. Therefore, get tested. Here is a link to our test. Subscribe to it and get tested so you can know where you are when it comes to coronary artery disease and your risk for heart disease.